Hi, Sylvain from Mancuso Clinic. Today, the video is about headache. Headache is a big issue we see at the clinic, and we need to differentiate two types of headache. One, the cervicogenic headache, or the migraines. That is not the same. The first things about headache migraines is to be sure there is no underlying health condition, and the best way to know if the headache is not a red flag is to go to see your physiotherapist, osteopath, chiropractor, or physician to be sure that there is no red flag under the headache. Now, about headache, we still have this three pillar approach about nutrition, physical health, and mindset. And again, in this program and this video, we are going to try to tackle the three pillar of health: physics, nutrition, and mindset. First, talk about physics. When we talk about headache, you can imagine that sometime again, the headache is just the visible part of the iceberg. If we take a patient there and there. When you have some headache on the back of the head, sometimes it can come from the neck. Your posture can be involved in your headache, and be sure that your posture is the right one is really essential. Any issue with your muscle could definitely give you more headache too. There. And any issue with your working station, for example, could increase the risk of headache. Any tension, like on the back of the head, on the front of the head, or sometimes on your upper back, that you are going to lean over, is going to ask to your upper back on the back to work more. And because of that, you will create some muscle tension, who is going to increase the risk of headache too. It's why I have a tailored exercise routine with a good balance between front and back and left and right can make a huge difference to manage your headache. Thinking about your workstation is really important too, because staying sit down for days and days in the wrong position will increase the risk of headache. How you can try to manage physically your headache? First, do some stretching. There is a lot of different stretching that you can do for your headaches. Side bending, bend over. We can stretch your upper back with really easy exercise. To do some yoga to really try to keep your upper back more loose, and it will reduce the risk of headache or cervicogenic headache, because the cervicogenic headache often are going to come from the fact that the rest of the body is not doing its job, and at the end is the neck doing its job. And if you have a global approach, if we can go further than the upper back, you can understand that your hip position, or sometimes your feet on the ground, is going to change all your posture, and at the end will give you some headache. It's why have a good posture is really important, and a good balance about your exercise routine and your stretching routine too. When we talk about the mental and the mindset about headache, we talk more about stress, because often the stress is going to go more in your upper back and neck. And as we understood at the beginning of this webinar about the connection between the tension in your muscle, which is going to increase the risk of headache, the tension come from the stress is going to increase the risk of headache too. It's why be able to manage your stress with some respiratory exercise, going to see a therapist like a psychologist to help you manage your stress can make a huge difference in your headache. The importance of that is to realize what's the trigger of your headache. Do you have a headache just when you are sitting down, or just the headache is going to come after an activity, or maybe after an event? And depending how the trigger is and how the headache is appearing, it could give you some information about the issue under and why you have a headache. Because at the end, the headache is just the symptom, and the more important is to understand the root cause, and stress can be one of the cause of headache. You need to learn how to manage it. You can use some respiratory technique, go to yoga, go to therapies, but thinking about the mindset when you have headache can help you to reduce this type of issue. And the last pillar of this approach about headache is going to be the nutrition side. Again, we are going to talk about the inflammation, because what you eat will make a huge difference in the inflammation in your body. Some people will have more headache when they eat some sugar or some different type of food. Sometimes some food allergy is going to give you headache. And it's why be aware about the trigger will help you to manage better your headache. We often see people with headache when they don't drink enough. I talk about water, and drink enough water during the day will help you to reduce the risk of headache. Avoiding any inflammatory food like sugar, dairy product, or processed food will help you to reduce the risk of headache and manage them to reduce the risk of inflammation. How you can reduce the inflammation with food? Omega-3, be careful about the vitamins, really be careful about what you eat, and it will reduce the risk of inflammation and help you to manage your headache or any issue like that. To recap about this video, we always think about the three pillar approach. On the physical side, things about your posture, some stretching routine, adapt your walking station can make a huge difference on the physical side of headache. On the mindset or the mental health side, managing your stress is going to make a huge difference because you will reduce the tension on your upper back and neck. And on the nutrition side, be careful about any nutrition allergy, any food that could trigger your headache, and try to reduce the intake of inflammatory food, sugar, dairy product, and processed food. If you want to have more information about headache and how we can treat people at Mancuso Clinic, you can just send us an email at info@mancuso-clinic.com, and we will be happy to take care of you. But always think about the root cause of the problem and just not only the symptom, because the symptom, it's only the tip of the iceberg, and be aware of why you have the pain will help you on the long run. Have a great day.